Now we have with us Dr. Jithu Jose, Vice President, International Division of Apollo Hospitals, India. Dr. Jose, how do you feel?
Thank you. Excited. It's always lovely to be in this beautiful country. We have been engaging Sri Lanka for over 4 decades, and the journey is taking a new level today with this Health Connect initiative. Thank you.
What are your views on bringing this convenience to the public by connecting healthcare services from across the world to communities? What do you have to tell us about it?
Well, we at Apollo owe these thoughts to our chairman, Dr. Pratap C. Reddy. When he founded Apollo way back in 1983, the mission statement was to make global healthcare within the access of every individual. And he envisioned that healthcare has to be a shared responsibility. Any such collaborations like Langa eDoc, where you're connecting medical fraternity, sharing information, it's all going to finally help the patients get better treatment, faster healing, and it's high time that the doctors connect, work towards the common objective of healing, because the disease patterns have changed. We have seen living in a world where pandemic has affected us. Healthcare resources are shrinking. There is a supply-demand factor which is globally affecting when it comes to healthcare professionals, technology, financial resources. So the way forward has to be collaborative. When the world was stuck with pandemic, that was the time you saw how countries were coming together, helping each other. So people said deglobalization will happen after pandemic, but in fact it gave a new way of globalization, which is all about healthcare taking the first step. And this initiative is a continuation, and I'm glad that India and Sri Lanka, apart from the common cultural grounds, we share a long tradition, and in the healing mission it's going to be very exciting, and I'm sure it will benefit the doctors in India and Sri Lanka, and finally it will help patients. That's more important.
With your experience of being a part of international expansion or expansion initiatives across the regions, how do you see healthcare progressing or developing in the next 5 to 10 years?
Well, healthcare has to be driven by technology. In Apollo, we have started the Apollo Pro Health, which is artificial intelligence enabled, where you get a predictive risk assessment. Because normally when somebody does a health checkup, it's just the organ functions. You check the liver function, kidney function, and cholesterol levels, and that's the health checkup. What we did is to enable AI interpretations to say what happens based on an individual's lifestyle, anxiety levels, stress factors, sleeping patterns, all of that combined, and therefore a corrective mechanism is possible. Now, the future of healthcare will always be technology enabled. So we have seen open surgeries becoming laparoscopic becoming robotic. Now we are seeing a world with scarless surgeries. So healthcare will advance more. There was a time when a patient has to undergo a heart surgery and be in the hospital for 10-15 days. Today we have minimally invasive cardiac surgeries. We can replace a valve through a catheter today. So the progress will be technology driven. What is more important is how the training and how does it reach to every nook and corner of the world. That is more important, because we've always seen that healthcare, the way it progresses, it is different speed in different countries. So connect initiatives will help all the countries to take that step forward. You need that exposure, you need the technology to be availed, and you need collaborative effort. When we established the first proton beam therapy center in Southeast Asia, we welcomed all our partners across the globe, so that the doctors there, even before the technology reaches their country, will know how to use proton center, and that has created a huge impact. So similarly, collaborative efforts will only help every country to progress. It is the time that the world unites. And as Dr. Niluka was mentioning, the war that we need to fight is against diseases, and that has to be a global war. So only that way we have to focus on preventive healthcare, we have to focus on non-communicable diseases, we have to also see and prevent another pandemic. So a lot more pressure, and I'm just saying, on the service side you need support, on the pharmaceutical side you need support, on the diagnostic side, and healthcare as an entire 360-degree approach has to progress. Only then we will have a healthy world. We have achieved a lot across the globe in the last 100 years. The next 100 years needs more consolidated efforts, and that cannot be isolated efforts. You can't just expect US to progress and ask the rest of the world to use US. No, it has to be everywhere, and only then we can have human civilization progressing to next level. Thank you.
I have one last question for you, Dr. Jose. What's the potential you saw in Sri Lanka to bring this to our country?
So Sri Lanka as a country has one of the finest healthcare system, which is driven by the government as well as private providers. However, what more needs to come to Sri Lanka is in terms of enriching its super specialty space and also developing the subspecialty space. And I think that is where we can bring more value, giving affordable access to more technology, getting training exposure to the doctors, and finally, as I said, it's all about connecting healthcare professionals, and the Lanka eDoc will play a big role as an enabler in this.